Decent public transport is expected as a right in the developed world, but for many in the majority world, just getting to market is a battle. Making it to hospital can be near impossible, so ways to ensure emergency medical help in remote villages can mean the difference between life and death. In Taking Off, Hands On looks at 5 different ideas that are helping people get around while transforming their lives. Over 20 million people around the world need wheelchairs. You wouldn't think that design was a big issue, but the majority of those donated to developing countries are rendered useless when faced with harsh roads and rough ground. Now, local engineers are being trained to build wheelchairs in country. Designed for the specific environment and built with readily available materials, they're dramatically changing the lives of the disabled. The organisation Motivation works with local partners to train people in wheelchair technology. At the Tanzanian Training Centre for Orthopaedic Technologists in Kilimanjaro, these students are starting a 1-year course producing wheelchairs using tried and tested designs.
At the moment on the course we have students from Tanzania, Uganda, Sierra Leone and even 2 from El Salvador, because we've been invited to replicate the course in Central America for the whole Latin American region.
In the past we have war and we have a lot of people with disability, and those people is not able to buy some wheelchair highest price. And the reason to be here is to have one course like this in our university.
Daniel and Agnes completed the course 2 years ago and have set up on their own, but they're having to compete with imports like this one made in China and donated by an American organisation.
There are some disabled people who have spinal cord injuries, so then if they sit on the chair like this, they're likely to get pressure sores. We do not provide the chair without measuring the person. Also, we just see the points of environments where the client stays, if it is a town or it's rural.
10-year-old Emmanuel has been disabled since birth. Until 6 months ago, he could only get around by crawling and couldn't attend school.
We came here, we visited, and then we took him to the place where we are making wheelchairs. So we started measuring him. After making the chair, Emmanuel now started going to school because he has the chair and no hard work of carrying him on the back of the mother.
He is a much happier boy now and is just like my other 5 children.
Onesmo suffered a spinal cord injury 24 years ago and lives on Mount Kilimanjaro. His journey to town takes an hour and a half over rough tracks and roads. He's been using a Motivation designed chair for 5 years.
Since I got my wheelchair, my life has transformed. Even socialising with other people is much easier. We're now on a level. If they have a wife, well, I have a wife since I got this chair. Other people have children, and I too have a child. If they talk business, I have a business too, so I'm on an equal basis with them, you could say.
At the Kilimanjaro Association of the Spinally Injured, Kazi, Onesmo is learning skills he uses to earn money from home, in a project supported by the UK Department for International Development, DFID.
Kazi's main objective is to bring disabled people together so that they can exchange ideas and find means of addressing problems that arise from their disability.
The programme that we're running with CASI, which is DFID funded, is looking at the rights of disabled people. So it's not enough just to give someone the right wheelchair, you've also got to help them access their rights. The wheelchair can be the catalyst to actually get people out, but then you need to look at the other areas of their life, so their economic empowerment, whether we can help them to access work, employment, education. All of these areas are really important, so the wheelchair is just the starting point.
Portugal, one of the fastest growing economies in the European Union. And tourism, a big revenue earner, is booming. Every year, 12 million foreign tourists head to Portugal to soak up the sun. beaches are the main attraction, but unfortunately, many holidaymakers fail to recognise the dangers of the sea and tide, and each year around 30 people die. If tourists and the economy are to continue to boom, visitors need to be safe. One initiative on Portugal's coast brings safe mobility to beach users and the lifeguards who look after them.
Nazaré lived essentially off the fishing industry, with some tourism, but fishing has slowly been replaced by tourism in terms of economic importance. The survival of this town's population is essentially linked with tourism.
The main problem is that we have a little bit more than 500 kilometers of physical beaches, geographical beaches. Only one part of that can be watched by lifeguards. So it's very difficult economically and physically to provide lifeguards to cover all that coast.
The Healthy Beach Project, supported by the Vodafone Foundation, aims to minimise risks for beachgoers. To make the beaches safer, they've supplied mobile phones to the lifeguards and given free coverage for all emergency calls. At each lifeguard station, the number is clearly displayed.
We receive mobile phones, which when we have a problem on the beach, we can contact headquarters or each other. Yesterday, for example, a young girl was lost somewhere on the beach. We discovered her 2 kilometers away. With the use of the mobile phone, we were able to locate her from another lifeguard. With a mobile phone, it was much easier.
The Vodafone Foundation donated, in terms of security, life-saving equipment, 14 jet skis with stretchers for carrying accident victims.
A special stretcher turns the jet ski into a water ambulance that can quickly bring the injured or exhausted back to shore.
If someone was 200 to 300 metres away, we had to swim, and it took us a long time. 4 to 5 minutes, depending on the lifeguard. Today, it's as easy as getting the jet ski running. Even with a little experience and a rough sea, we can reach the victim in a few seconds. Recently, we had an accident with 22 people drowning at the same time. With the jet ski, we were able to rescue 10 people, and the lifeguards picked up the rest.
It helps a lot because if there's an emergency, then he can just go quickly instead of swimming. It makes life more easy.
But it's not just those who need rescuing who benefit. A major part of the initiative is to improve accessibility. Ramps and walkways have been built to help people with disabilities to get around. They're also useful for parents. Specially designed wheelchairs allow the disabled to travel across the sandy surface that would hamper ordinary wheelchairs. They can even enter the water, making Portugal's beaches more widely accessible and safer. Motorbikes have a reputation for danger. But here in rural Gambia, they've got no image problem. They've become healing machines for delivering life-saving help to remote communities. In many countries, an ambulance service is the vital link, transporting patients, vaccines and life-saving medicines. But in areas where petrol is expensive and roads unpredictable, the flexibility of two-wheelers is proving the best way for community medics to deliver life-saving help. Riders for Health is training teams of health workers as motorcycle riders and mechanics, turning their bikes into disease-fighting machines. This man sustained a head injury and needs to get to hospital, but he's in no condition to sit upright on the back of a bike. Luckily, this motorbike has been modified to a Riders for Health design to become a multi-purpose workhorse covering 9 villages. The stretcher turns it into a makeshift ambulance.
We get this motorbike school. If you have a patient, you need to rent a vehicle. Some people are really poor. They cannot afford to rent. And if they have a woman who is also laboring at night, the woman has to stay like that with that pain until daybreak.
As well as a stretcher, the sidecar attachment can carry passengers and a trailer extra supplies. An attachment to the rear wheel can even turn the bike into a water pump. Suleiman Singara is the senior mechanic. He makes sure all the motorbikes in the Riders for Health fleet are given a monthly check. Many bikes are donated, but not all are up to the job. Certain features are vital for a life-saving motorcycle.
We need to have a motorcycle which you know that the consumption rate of fuel is low and the chain is completely sealed with cover. Because you cannot have sun and dust cannot have access to go inside. But if you don't give a motorcycle which is suitable for our terrain, we are always in a problem. Okay, this is a motorcycle graveyard. So as you can see, they are no more useful to us anymore. Because the simple reason is they are not suitable for our terrain.
The technical expertise is recognised by the Gambia's Ministry of Health and non-governmental organisations that pay Riders for Health to maintain their vehicle fleets. In health, as well as mechanics, prevention is better than cure. And the bikes also help community health workers carry out routine checkups on patients. It's just after sunrise and community nurse Lamin Sangyang is about to hit the road. His first patients are a mother and her newborn daughter, and he's joined by the traditional birth attendant who delivered the baby.
But whenever I have this motorcycle, it makes everything very easy for me. And anytime I make appointment with them, my appointments are always successful.
I would like a motorcycle because of the distances between the compounds in the villages. They are very far. We don't have a health facility here in this village, and to walk to Lamin's village, especially in the middle of the night, is difficult. So yes, I would like a motorcycle.
Next stop is a pregnant woman with anemia. Lamin first advises her to eat foods like green vegetables, fish and ground nuts to enrich the blood, and tells her how to protect herself against malaria.
She is now going to spread this on the bed. In the evening, she will tie it up.
Lamin's final stop of the morning is Basori Lower Basic School to give a lecture on personal sanitation and sexual health to a class of teenagers.
Now we are going to talk about the famous HIV/AIDS. That's our immune system, our body mechanisms that fight against the diseases. They are soldiers. They are body soldiers. Any question? Yes?
As the Gambian sun slips below the horizon, Lamin is called out again. Having reliable wheels has transformed his working day.
Transport in health service delivery are crucial. They can mean life or death. Without transport, you can't reach the poor woman in the village or the poor child in the village. You can't reach to the school to talk about health and HIV/AIDS. You can't do that. So it's crucial to have transport in this link between the health worker and the community.
The open road is every motorist's dream, but in rural parts of Cambodia and Vietnam, it's more likely to be rutted and pockmarked by gaping potholes, slowing vehicles to a crawl if they survive the journey at all. New ways of using cheap local materials are smoothing the way for Southeast Asia's cross-country traffic. Angkor Wat, built during the 12th century, has stood the test of time. The complex was built on a foundation of laterite, a local clay. But the laterite hasn't performed so well for Cambodia's road network. Drivers rear and dip along roads potholed by tropical weather and overloaded trucks. The bad roads cut off rural communities and slow down economic and social development. But the cost of standard road building can be prohibitive. Bamboo with local stone and brick is being used in Cambodia and Vietnam in a project supported by the UK Department for International Development, DFID.
In essence, what we're trying to do is develop road construction and surfacing techniques that are, first of all, affordable, have low maintenance, and also create job opportunities.
A good road needs solid foundations. Bamboo grows easily in many parts of Asia, and laid as lattice within the road has proved as effective as imported steel in reinforcing concrete roads.
As we're looking for local solutions, we find relatively mature bamboo, split, of course it has to be straight, but we use it basically as we would a thin steel rod.
Using local materials for the road base means women can earn cash by hand breaking stone.
In this country where labor It's abundant, it's cheap, $1 a day, everybody happy to work with. This is an ideal local resource. Most of the investment will go to the local economy and generate direct employment and as well as indirect.
Depending on the quantity of stone they break, these women earn on average $50 a month, around $1.50 per day. South Vietnam has a thriving brick-making industry. The kilns are active day and night, using rice husk as a renewable energy source to fire the bricks. This traditional brick is emerging as an ideal material for road building.
We hope the Provincial Transport Ministry will approve greater use of bricks for our rural roads, so we can expand our business beyond house building to provide the materials to surface our roads.
We have quite a high traffic flow on this road, approximately 3,000 motorcycles a day. Car traffic is about 50 vehicles a day, and commercial vehicles, mostly light trucks, about 300 vehicles a day.
Whatever the surface, all traffic causes wear and tear. But overloaded lorries are the biggest problem for road engineers.
These problems have to be tackled because you cannot design a road strong enough to support heavily overloaded.
Width restrictions on rural roads are stopping lorries more than 2.5 metres wide and helping to preserve the road surface. Regular maintenance is also prolonging the life of the existing gravel and earth roads.
When we construct a gravel road, we have a camber like this so that when it rains, the water sheds to both sides. With traffic and rainfall, that tends to go flat and start to pothole. So typically every 3 months or so, we should come along and reshape.
This prototype road grader can be used for just that. All labour and parts are Cambodian, apart from a steering column made from second-hand car parts from Japan. This one is being demonstrated to the Halo Trust. They're hoping it'll help them improve access to remote minefields that are still not cleared.
This tower grader is pulled by agricultural tractor. The power, 30 h-power, can be pulled, and very useful here in Cambodia for maintenance the rural road.
The trial phase of this project in Cambodia and Vietnam has come to an end, and while the technical results are still being assessed, it's clear things have improved.
People used to row their boats on the old road during the monsoon floods. Now the community are very happy, especially the school children, as they can get there on time rather than being late for their morning lessons.
Tanzania and Kenya, East Africa. AMREF's airborne doctors are the only specialist healthcare available in the remotest parts of this region. But the doctors often have no idea of the cases they will face when they land, or even the availability of medical equipment and supplies on the ground. Now, technology is giving the flying medics a head start in preparing for their flights of mercy.
The hospitals are very much apart. The people are scattered all over the country. The countries are very big. The infrastructure is very poorly developed. There are no social amenities, so it is difficult to get a specialist.
People sometimes need to travel over 100 kilometres on poor roads to get to their nearest hospital. Once they've arrived, there's often no relevant consultant doctor to help them. The Flying Doctor programme flies specialist doctors to hospitals to diagnose and treat patients.
We go to selected hospitals in all over East Africa performing routine elective surgery. Those are the surgery which most likely the doctors in the hospitals can't perform.
The Flying Doctors can also train medics on location.
We are also involved in quite a bit of what we refer to as could be on the job training, whereby you meet some relatively junior doctors and then you teach them some procedures which most likely you think they'll be comfortable to do on their own.
Communicating with isolated hospitals wasn't easy, so doctors often didn't know what to expect when they arrived.
It would make a lot of sense that the hospital informs the specialists what deficiencies they have in terms of equipment, in terms of certain essential supplies. Instead of just the doctor just flying in and finds that there are so many patients, no idea what they require, and then after the end of the day, then you end up doing very little.
To improve the system's efficiency, Safaricom has set up a pilot telemedicine scheme. Using the internet, hospitals can get vital information from specialists well before the doctors take to the air.
A doctor in the rural area, for example, this is Kibondo Hospital, sees a patient whom he cannot handle, and then we will take a digital picture and write the notes history of the patient. Say, there's this patient with this 1, 2, 3, we need a second opinion. We call a consultant from Nairobi, and the consultant will come and answer and say, look, this patient, you can do 1, 2, 3. And we email through the internet the answer, and the doctor there does what we have said.
It's also good news for the flying doctors themselves, preparing them in advance for each particular case.
No, it just could be a strike of the button. They've got all the information about all the patients, just like you're seeing the patient yourself. Either I'll advise you, this one you can do this even before I come, or when I'm coming, could be there are a few things that I'll be prepared when I'm going to meet that patient. So it would make quite a big difference for sure.
At the moment, the pilot scheme covers 4 of the most remote hospitals. But if successful, it may take off across the region, helping many more gain access to conventional healthcare.
It improves communication because now you can get second opinion. A patient who would have been stranded, you are able to ask and you are told what to do, and overall improve the quality of care in that hospital. Because now you are not blocked by what you know, you can always find out what else can be done, so you save life.